They call it the big, beautiful bill. But if 11 million people are going to lose their insurance, what is so beautiful about that? Moms are being told that they're getting more coverage, they're getting more support, but that coverage is optional. The support is underfunded, and rural hospitals are shutting down. Hello, everyone. My name is Dr. Choa. I'm a Harvard trained emergency room physician who works in Atlanta, Georgia with pregnant and postpartum moms. As a founder of EM Care to You and someone who knows that postpartum care does not stop at 6 weeks, I believe that your coverage should not either. Today, we're going to talk about the big, beautiful bill. A lot of policymakers out there are touting this as a win. They're saying this is going to be so amazing for moms. They're saying that Medicaid is going to be expanded, there's going to be childcare tax credits. They're celebrating, but honestly, I do not believe that there is something to be celebrated. And in fact, I would think that a lot of people in the maternal health world also agree with me right now. No major birth organization is calling this a win. Why? Because it is not. This bill is confusing, it's contradictory, and it offers surface level support for our moms while gutting the very systems that moms rely on to survive. So, what does the bill say that it does? What are the wins that our policymakers are touting as wins for moms? Number one, they're saying that moms are going to be able to get expanded postpartum coverage. So, instead of just covering one visit at 6 weeks, they are now saying that moms are going to be covered through 12 months. They're also saying that child care tax credit is going to be increasing. The annual employer provided credit from 150,000 to 500,000 with higher reimbursements for small businesses. So they're incentivizing businesses to cover for child care, right? All right. And then SNAP work requirements. These are food stamps. They're saying that it's not going to affect you if you're pregnant or postpartum. You are exempt, and the caregivers of young children are exempt. Sounds promising, right? Okay, we're going to look under the hood. We're going to take a look at each of these things. And at the end of this, you're going to tell me if this is a win. Okay, so let's talk about the reality. Who is this bill leaving behind? Let's start with Medicaid. The Congressional Budget Office estimates that this bill would cut Medicaid funding enough to eliminate insurance for 11.8 million people over the next decade. Even though pregnant and postpartum women are exempt from work requirements, states may still cut postpartum programs to offset lost federal dollars. So you're hearing me. If it's up to the states to allocate their budgets for Medicaid, do you think that they are going to keep some of these programs? Right now, 12 months of postpartum coverage is up to the state. It's not a federally mandated thing. The state gets to decide on that. So if the state has to allocate money for this particular thing, they can easily cut this benefit. So it's really not an added benefit. In fact, before the big beautiful bill was out there were a lot of states that were covering moms through the 12-month. And so hopefully these states continue to do this as long as we continue to make noise, and hopefully other states follow through. We pray that when it's time for budget cuts and when it's time for states to look at their budget and what they're spending money on, that they can please hold on to this. So this is not necessarily a win. It's something that was there before the big beautiful bill, and it still is up to the states to provide. A lot of the services like doula care, home visits, pelvic floor therapy are only available in states. Again, a lot of states were covering for these things, and it was per the state's budget. If you reduce the Medicaid budget, a lot of moms now are going to lose their doula care coverage, lactation support, home visits, pelvic floor therapy. States still have to opt in, so it has to be a priority for them. Medicaid might cover your birth, might cover your postpartum up to 12 months, but only if your state feels like it. And only if you manage to stay enrolled because there's so much red tape. You have to prove so much. All right, so we talked about Medicaid. Let's talk about child care. The new law expands the employer tax credit for child care. But here's a catch. Only 12% of businesses use this employer tax credit. So, this is not going to lower your daycare bill. It won't get you a spot at the daycare center down the street. And it definitely is not going to help you if you're unemployed or working part time without benefits. Well, I don't really know how this is going to help my pregnant and postpartum moms. Let's talk about SNAP or food stamps. So the bill extends work requirements to adults up to age 64, including parents of children age 14 and up. While pregnant women and parents of kids under 13 are technically exempt, these new rules will increase bureaucratic hurdles and lead to accidental benefit loss, especially moms who may not be the most educated, who may not be tech savvy, and maybe families who just may not have the technology around or the patience really to sift through all of the paperwork that needs to get done. This bill doesn't cut food stamps directly for pregnant or postpartum moms, but it makes it harder to prove that you are exempt. And it increases the number of hoops families have to jump through to eat. Part of equity is that people don't have to jump more hurdles or hoops to get to the final endpoint. If this person is able to get here quicker and this person has to jump a million hoops, that is inequity and that is not okay. Until it affects you, you may not see anything wrong with it. Unfortunately, this bill is going to create a lot of hurdles and hoops for moms and pregnant women who need food to survive. Let's talk about the overall ripple effect this bill is going to have on hospitals and rural moms. So, I'm an emergency room physician, so I see people who are uninsured every day. I travel to distant places, rural hospitals, where I see everything come through the emergency department. I have to transfer moms who are postpartum to centers far away so they may get the definitive care they need. Right now, a lot of these rural hospitals are stretched for resources in terms of manpower and funding. Cutting Medicaid is really going to affect these hospitals first. In the emergency department, I am legally entitled to treat everybody. I have to treat the uninsured. I have to treat the pregnant patient in labor. Cutting Medicaid is going to make so many people lose their coverage and it is going to stress our hospital systems. These people who are coming to the emergency department are not paying. So we're going to stress hospitals, particularly rural hospitals, and they're not going to be getting funding to keep their doors open. Millions of people are going to lose their Medicaid. Hospitals are going to see higher uncompensated care costs. Rural hospitals are going to lose hundreds of millions of dollars in healthcare dollars. That could mean up to 140 labor and delivery units are going to close. That will mean a lot of hospitals are going to shut their doors and not be able to provide care. So, while Congress is patting itself on the back for extending Medicaid postpartum coverage, hospitals are going to shut down. What good is it that you are going to be getting 12 months of postpartum coverage, potentially, maybe, if your state is going to give it, when you don't have any hospitals to provide the care, when your doctor does not have any appointments to see you? What kind of trade-off is that? Who's going to get hurt? Let's talk about it. Who is this bill going to actually help? And who is this bill actually going to harm? If you are well to do, this is probably not going to touch you. You're not going to lose SNAP benefits because you don't have them. You're not going to lose your Medicaid benefits because you may be able to pay out of pocket and you may be insured. So, for a lot of people, they're thinking, this is not going to affect me. My Black and Brown women, we already face high maternal rates. Black women are 3 to 4 times more likely to die in childbirth. Now we are going to face even more fragmented care. Rural moms, you are already driving 90 minutes to deliver a baby. Now you may not even have somewhere to deliver your child. You may need to travel further. You may even have to rely on the neighborhood midwife to deliver your baby, which, if you are a high risk mom with a complicated pregnancy, that is not an option for you. My working class moms, you're already hovering. You may be using marketplace insurance. This is going to affect you, right? Because now they may be cutting that coverage. Your premiums may be going up. You may not be on Medicaid, but you may be on marketplace insurance. You're going to see your premiums go up and you may lose your coverage because you can't afford it. You're going to have to choose between eating and medical care. And that should not be something that any mom has to think about. This bill is going to widen the divide. It's going to deepen the systemic inequities that already exist in this country. It seemingly protects moms on paper, but it fails in actual practice. These policymakers don't work in the hospital. They're doing these bills or cutting Medicaid, they're cutting food. They're not understanding the ripple down effect. As an ER doc, I see it a mile ahead. I'm seeing what this is going to do to our hospitals. I'm seeing what this is going to do to our moms. This is going to be a crisis for our country. It's going to be a crisis for our rural moms. It's going to be a crisis for our Black moms. It is going to be a crisis for our working class moms. We are going to have to put our big pants on. We are going to have to advocate for our patients now more than ever. As a community, we're going to have to come together. This bill might be law, but we don't have to make it take our patients down. We don't have to allow these consequences to affect our pregnant and postpartum moms. We're going to have to put pressure on our state lawmakers. Mom, here's what you can do in the meantime. You are going to have to learn to advocate for yourself. You're going to have to learn your rights. You're going to have to know what your Medicaid covers. You're going to have to know how to fill out the paperwork for your SNAP benefits. We're going to have to start right now educating each other about how to do this. If you've done it before, you got to help your neighbor, you got to help your friend. We're going to have to do a lot more community gathering to make sure that our moms are covered. Here's something else that you can do. You're going to have to ask for postpartum visits beyond the 6 weeks. If you're living in a state that allows for 12-month postpartum coverage, I need you to start making those appointments ahead of time. You're going to need to see your doctor more than just one visit in that 6-week postpartum period. This is important for your care. We want to make sure that, particularly if you're a high-risk mom, that somebody is checking on you. Nobody's going to bug you to put these appointments on the calendar. You are going to have to do this by yourself. You're going to have to ask your doctor about that mental health, because if you're covered for mental health resources, if you're covered for doula, if you're covered for pelvic floor therapy, schedule it all. But you won't be able to know this unless you take a look at the fine print of your insurance, unless you know your state's Medicare rules. Don't rush this process. Ask your questions. If a doctor is rushing you, tell them, I really need to know about this. Can you please sit down and talk to me about X, Y, and Z? Do not be silenced. Bring a support person to your clinic. Ask the questions and document everything. And if you are a mom who may have the resources, who may have the tech abilities, volunteer to help another mom. Support the village. Volunteer with birth justice organizations. Let's create postpartum collectives. Let's create doula funds. Let's create mutual aid for moms, local moms, rideshare appointments, meal trains, childcare swaps. We're going to have to do this together. We need to get back to being a village again. You may have been blessed with more so that you may bless others. If you've been blessed with more resources, there's a mom who has less. How can you help somebody else today? Lastly, we're going to need to advocate for our rural moms. We're going to have to push for telehealth reimbursements. We're going to have to get creative with our med tech devices. Our rural moms need us. Our rural moms cannot be left behind. We're going to have to call for funding for mobile clinics. We're going to have to call for funding for home visits. We're going to have to figure out how to cover and license our community midwives, especially in rural clinics or rural areas. We're going to have to support policies that protect rural hospitals and increase Medicaid reimbursements rates. And we're going to have to figure out how to grow the workforce. How can we get more birth workers in the community doing the work and getting paid for it? Let's support education for midwives. Let's support licensing for midwife. Let's support doulas. Let's support education for doulas. Let's demand that Medicaid pays doulas and community navigators living wage because they are doing God's work out there. They are saving our moms. Let's push for culturally competent community care-based options to be recognized and reimbursed. The big, beautiful bill says that it is helping moms, but if your coverage is optional, your care team is underfunded, and your hospital is closing, what exactly did we win? That is not a maternal health victory. It's a step backward, wrapped in pretty language. We deserve more, and we're going to keep pushing. My name is Dr. Pindi Lachoa, and this is more than policy. This is about survival. Until every mom is seen, supported, and advocated for and protected, I'm not going to stop speaking. And we should not. I want you to share this episode. I want you to like this episode. I want you to subscribe to my channel. Email your state representatives. Ask your OB what services are covered. Research your Medicaid, what services are covered. Build a care plan. Build a village. We cannot wait for systems to save us. We save each other. Let's start now. Are you navigating pregnancy and postpartum alone? Are you feeling overwhelmed by the lack of support? You're not alone, and you don't have to do this alone. With EM Care to You, I offer personalized in-home and telemedicine support designed to guide moms through the challenges of the postpartum period. Whether you need total on-call services or periodic check-ins in the home, I help women recognize the warning signs, and I support you as your advocate, and I am here for you the entire step of the way. I want to create a postpartum plan that's all about you, your health, and your recovery. Follow me on Instagram at Dr. Choa for tips, resources, and there you'll find a way to book me. All right? DM me or email me if you have any other questions. Other than that, I'm on all social media platforms under Dr. Choa, DrChowa. Let's build a village of support. Let's give you the hope that you need to get through this period of time. Take care. My name is Dr. Choa, and it's been lovely talking with you all today. Take care.